Welcome to the channel. Yet another update as to what does the new virus strain mean for India. Now I will say don't fall for rumors, follow evidence. Now there are some very important questions need to be answered. First, how prepared is India to tackle this new strain? Why is the mutation a real concern? Thirdly, what measures have the government taken to protect against the new strain? Will it make the vaccine and the current treatment redundant? How do vaccine makers plan to adapt? And lastly, the most important part, is India moving towards one more lockdown? Can we really afford one more lockdown? Let's search for an answer to all the questions. As 2020 draws to a close, the news of a mutated version of the virus being found in UK has once again rocked the global anxiety. Just as the first crop of the vaccine started giving a glimmer of hope to people reeling from the pandemic, the UK government's announcement of a mutation in the novel virus on Sunday set alarming bells rising across the world. As anticipated, on Monday, the Ministry of Civil Aviation temporarily suspended flight from UK to India. So travel bans for air passengers from the country were announced, financial market tumbled, and there were anxiety over whether the vaccine would be effective against it or not. Over the last few weeks, there was a rapid rise in the COVID cases in the southeast England. Millions have already entered strict lockdown restriction in London and the southeast England owing to this new strain. The worst is that the report suggests that this particular strain is over 70% more infectious. So the question is, where has the virus come from? What will be the implications? What do those in India need to know? These are some of the questions running in the minds of one and all. The fact that the prevalence of this new strain had been gradually rising since October suggests that it is a harder strain. The strain has been reported to have 23 mutations, of which 2 deletions in the viral spike protein may be associated with the increased transmission. In the last few days, people were asking of how and where from and the source of this mutant virus. Now, to explain you, viruses are known to constantly mutate, and it's no different. Most of these mutations occur by random chance as the virus replicates, and several different strains of the virus have been noted since the start of this pandemic. Sometimes viruses also mutate due to the antibodies present in the population threatening the existence of the virus as whole, and thus mutation could occur that are purposefully to evade the host defenses. This type of mutation tends to occur when a significant proportion of the population develops antibodies, either from past infection or from vaccination, and generally take years to occur. It is improbable that the newly discovered mutant strain falls into this latter category. The next question which comes in mind, why is this mutation a concern? The mutation in a virus, as in any other living organism, are a common factor responsible for evolution. The spike protein mutations allow the virus to attach more easily with the human cell and increases its transmission between humans by almost 70%. However, mutation in the spike protein of the virus is a major concern, and it allows the virus to transmit more, and more importantly, could have a potential impact on the effectiveness of medicines and vaccines, as many of them target the spike protein specifically. However, the World Health Organization have said that there is no evidence that the variant is more likely to cause severe diseases or mortality as of now. Instead, this is probably the first pandemic when mutation of a virus are being looked at so closely, and emphasize that while experts are learning a lot, there is no need to panic. The next more important question, what measures have the government taken to protect against the new strain? What does the new COVID strain mean for India? It means that we cannot afford to lower our guard. The precautions that need to be in place, like masking, sanitizing and social distancing, and the avoidance of the 3 C's, closed space, crowded space and close contact, should be adhered to, as velocity with which the virus spreads across the world makes it likely that this mutant virus will find their way to India sooner or later. However, the government on Monday banned all flights and from UK from Wednesday to 31st of December. It also issued a new standing operating procedures wherein the government will conduct test sequencing of all positive passengers arriving from the United Kingdom between Monday and Wednesday to determine whether they have been infected by this new strain of the virus found there. It has also asked states an integrated disease surveillance program to set up monitoring of the travelers from and those who are transited through the UK and arrived in India from 25th of November to 8th of December. The government also directed that all contacts of infected travelers who have arrived at airports in India between Monday and Wednesday be subjected to institutional quarantine. Test sequencing will be done on the virus found in all the positive patients in that case. It is found to be of new variant. The patients would be isolated. Government also issued guidelines for the UK passengers. RT-PCR test mandatory and compulsory. That the RT-PCR test on arrival, separate isolation of these testing positive for the new variant of virus, and institutional quarantine for co-passengers of this testing positive are among the silent features of the standard operating procedures issued by the Health Ministry for passengers coming from UK. What precautions are to be needed to protect oneself from this new strain? Now, no new precaution need to be added to the existing one. We must keep reminding ourselves that even though our numbers seems to be getting better, the pandemic is far from over, and we need to work hard to prevent ourselves from getting a false sense of security. So, important question coming in my mind is, will it make vaccine and the current treatment redundant? Experts in UK and the World Health Organization, as well as the Niti Aayog and other Indian experts, have said it is unlikely to have an impact on the effectiveness of the medicines and the vaccines, though the research is ongoing. The World Health Organization said laboratory studies are ongoing to determine if the variants of the viruses have different biological properties or can alter vaccine efficiency. It is important to know how do vaccine makers plan to adapt. Now, this is very, very important. Now, Moderna and Pfizer, makers of the two authorized vaccine, have rushed to test their vaccines against this new variant. Now, Pfizer's partners with BioNTech has said a vaccine against the mutation can be made in 6 weeks. In India, vaccine makers have been silent on the mutation, but I remember that Zydus Cadila earlier said that if there is a mutation in the virus, its DNA vaccine can be changed and modified, and the vaccine can be provided in 3 months. As per the new report in Hindustan Times, the virus strain may be in India already. Now, on Tuesday, 22 people, including 6 from Delhi, tested positive for that particular virus, and their samples has been sent for test sequencing. So it is likely that a new variant may have already come to India. You will find it only if you are looking for it. This is the reason why we need to scale up the number of test sequencing that we are doing. India has the second highest number of virus cases in the world, and it is likely that some variant like it might have generated within the country too. Government says that the new virus strain will have no impact on the vaccine. Allaying fears over the muted virus strain detected in the United Kingdom, the government on Tuesday said it would have no impact on the potential of emerging vaccine. Addressing to a press conference again, Niti Aayog member said there is no need to panic and we are yet to spot such a virus in our country. As of now, based on our discussion, deep understanding of the data availability and our deep assessment, there is no need to panic, but it's a cause to be more vigilant. How prepared is India to tackle this new strain? What does this mean for India? Now, there has been instances in the past in which viruses have mutated to strain that may have been better at transmission but resulted in milder diseases. We will need to wait and look at patients' outcomes associated with the new strain to better understand the implication for the world. As of now, it should be a wake-up call for those who thought that the pandemic was over and we could stop taking necessary precautions. My suggestion would be, please don't believe in rumors. It says that the new strain of the virus has the potential to go in several directions, and that for now not much is known about it. Symptom wise, it is no different from the current virus seen till now. Please understand, one need not be swayed by rumors and instead should focus only on scientific evidence. While in itself, it is not unusual for the virus to have this kind of mutation, since it is the nature of the virus as small as this to keep changing. But what needs to be looked at is the number of people getting infected who are succumbed to this particular strain. We have been irresponsible in our conduct with social distancing and keeping masks on. Now, just because the lockdown restrictions are removed doesn't mean we can go back to the old way of life, because this is in some part of a consequence of that kind of practice that was in our life before March 2020. Moreover, any notification, update and breaking news, you will get updated and genuine information from this channel. So I request you to get involved with this channel and get updated news whenever video content is uploaded. Till then, thank you, take care.